The truth about mental illnesses. Mental illnesses consist of any psychiatric disorder that causes untypical behavior. Mental illnesses are caused by genetic, biological, psychological, and social underpinnings. A famous myth is that mental health problems don't affect me. Mental health problems are actually very common. 1 in 5 American adults experience a mental health issue. So imagine this. If you know 5 adults, scientifically, one of them has a mental health problem. Another myth is you're just sad, not depressed. Being sad and being depressed are two totally different things. Depression is not something a person can will away. People often have misconceptions that a person can just cheer up or shake it off. It is not just the blues, but a serious medical condition that affects the biological functioning of our bodies. There are treatments like cognitive therapy or medication that can help address the symptoms of depression. Next myth, psychiatric disorders are not real medical issues or it's all in your head. Just as with heart disease and diabetes, mental illnesses are a legitimate medical illness. Research shows there are genetic and environmental causes, and similar to other medical conditions, they can be treated effectively. No one would ever say to someone with a broken leg to walk it off. They will sympathize with that person and make sure they get all the help they need. This should be applied to mental illness too. Another myth is people with mental illness can't handle work or school. Stressful situations can be difficult for all people, not just those who live with mental illness. People with mental health conditions have jobs, go to school, and actively participate in their communities as well. Next myth, snap a rubber band on your wrist every time you have a bad thought. This is definitely incorrect. Studies show that suppressing your thoughts make them stronger and more frequent. Think of it this way, the thoughts you resist persist. A very common myth is that all neat freaks have OCD. This is not true, although a common sign of OCD is an obsession with cleanliness, such as constantly washing your hands or excessively cleaning household items. Jeff Semensky, an executive director of the International OCD Foundation and one of the world's leading authorities on OCD, said, "And that's a part of the confusion. If it's a personality trait, you have a control. We can choose to do it or not. If you have obsessive compulsive disorder, you're doing it out of unrelenting, debilitating anxiety." A mental illness that has a lot of dangerous myths is schizophrenia. Schizophrenia, quote, makes people dangerous. In popular culture, individuals with schizophrenia are often depicted as sadistic, unpredictable, and violent. Although it's true that some individuals with schizophrenia do commit crimes, the vast majority of patients are non-violent. In fact, of past violent offenders who did have schizophrenia, only 23% of their crimes were directly related to their symptoms. Unfortunately, the notion that all individuals with schizophrenia are dangerous contributes heavily to the stigma surrounding the disorder. People with schizophrenia often have reduced housing and employment opportunities, greater stress, lower self-esteem, and diminished quality of life. A popular eating disorder myth is that you can tell someone has an eating disorder simply by looking at them. Individuals with eating disorders come in all shapes and sizes. The media and other public discussions about eating disorders focus solely on individuals with anorexia. In reality, many individuals with anorexia may not even appear so drastically underweight. Furthermore, many individuals with severe disorders, including bulimia and binge eating, can be underweight, normal weight, overweight, or obese, and often fluctuate in weight. Even athletes who appear to be incredibly fit might be struggling with an eating disorder. The bottom line is that you cannot define someone's health by how much they weigh, and you cannot determine whether they have an eating disorder just by looking at them. The last myth is that people with PTSD are crazy and/or dangerous. Several classic war movies, as well as sensationalized media coverage, have helped perpetuate the crazy war vet stereotype, which is an inaccurate depiction. Rather, symptoms of PTSD surround coping with the memory and implications of a traumatic experience, like distressing memories and changes in mood. Furthermore, crazy is never the best word choice. Crazy is not a diagnosis, rather, it is a damaging and stigmatizing label. Don't think there's no hope for people with mental health problems. Friends and loved ones can make a big difference, especially by learning and sharing facts about mental health and also by treating them with respect just as you would anyone else.